It's pretty amazing that a baby can have a twisted ischemic gut and we are expected to make the diagnosis in the ED and save their life. Even though the symptoms may resolve completely after only one episode of vomit, the baby is completely asymptomatic in the ED, and how to make the diagnosis while we can still save the patient is not taught or emphasized in any pediatric or emergency medicine text. But once you do know that parents may not even mention a little green in the vomit, or even mention vomiting at all once it's resolved, or if they're much more focused on a different aspect of the illness, then the only way to be sure not to miss the tip-off is by making sure you always do a feeding history. This should totally change your attitude towards vomit. Now that you know, any history of bilious vomit may be the only clue of a life-threatening volvulus. And knowing this should totally change the way you plan on asking about vomit. Because not only will you ask the parents how many times the infant vomited and what color was the vomit, but even if they say only white or only milk, you're certainly going to probe them further and ask, only white? Was there any green at all? Because parents may not realize and may not mention that one teeny little fleck of green is important, but you do know that, and you're going to ask about it. And by the way, in case you see a 3-week-old infant on your next shift, when you ask about vomiting, also always ask about pure yellow vomit too. Because for babies under 4 months old, pure yellow or mostly yellow vomit is also considered bile. So ask about yellow too.